Welcome, ladies and gentlemen. I'm Dr. Sutter again. This is part 3 of the paradigm shift in healthcare. In this section, we're going to cover the medical paradigm. Now, when I started teaching people the natural healing paradigm and started bringing them back from sometimes terminal diseases, we ran into a big problem with the way people worship their medical doctor. And it was a huge problem for me. I spent most of my time trying to get through that mental wall to get them to accept what I was saying, even though I myself had overcome liver cancer. And I had plenty of testimonials available to these people to prove it. Okay? So it was a problem. And I had to take a real close look at what the medical paradigm is. I mean, what is it? You can go to your doctor tomorrow and say, well, doc, what is the medical paradigm anyway? And chances are he can't tell you. And I asked a lot of people what it was. I asked, again, medical doctors, PhDs, the college people, the university professors, and they couldn't really tell me. But here's what it comes down to. The medical paradigm is crisis therapy. It's that simple. Crisis therapy. I was a medic in the war, and I spent some time in the jungle and the fire bases. When we get in a firefight, someone gets wounded by bullets or shrapnel. It was my job as a crisis therapist to treat the problem at hand. The body had been significantly overwhelmed, where it required crisis therapy. So I stopped the bleeding, got the guy stable, we called in the dust-offs and got him to the hospital. And we were good in Vietnam too, we were real good. Very rarely did anybody have to wait more than 20 minutes by the time they got wounded and they were in a hospital somewhere. That's crisis therapy. Any overwhelmed situation. A couple of years ago, I was doing the dishes. Sometimes this guy's due to the dishes, and I was drying out a glass, and the glass broke, sliced my hand right open. It needed stitches. That's crisis therapy. Any overwhelmed situation your body gets into, that's crisis therapy. That's what the medical paradigm is, and they are great at it. These people are worth their weight in gold that do this, that put you back together after you fall, crash, you get in a car accident, get hit by a bus, bullets, shrapnel, it doesn't matter. These people are excellent at it, they're experts at it, and they will save your life. So the crisis therapy, the medical paradigm, is legitimate. It really is. It's used every day. They save thousands of people's lives. Now, that includes the ambulance driver, the medics in the ambulance, the emergency room people, the surgeons that put you back together, and their assistants, and the physical therapists that get all the parts working again. So the medical paradigm of crisis therapy is legitimate, okay? But here's where they go wrong. Say you go to the medical doctor. What's he do? You got some symptoms usually that are bothering you, and what does he do? Well, he sends you for a bunch of tests. Get a blood profile for you, get a CAT scan, all these other x-rays, whatever they need. But what is he doing? He's trying to narrow your symptoms down, and he's trying to name them. Because the only paradigm he has to work with them is crisis therapy. Okay? He needs something to attack. You've all heard about the war against cancer. I came back from Vietnam in 1971, and Nixon declared war on cancer. Now, if he had declared war on the cause of cancer, he would have had something. But he declared war on cancer. They need the disease process to attack, okay? Because that's their paradigm, crisis therapy, okay? So, treating disease processes, because they are so good at crisis therapy, people want them to be as good as diseases, and they're just not. It doesn't work. Because the rules aren't being addressed. Now, what kind of statistics do you get when you treat disease processes as a crisis? And this is the very reason we need a paradigm shift in healthcare. Number one, first, they can't cure anything. No cures. They admit it. They advertise it. They beg money. They have fundraisers for it. They get endowments for it. They beg money from the government for it. They can't cure anything. And they admit it. This isn't a deep, dark secret. You know, I've been a chiropractor for 37 years. I know that. My patients know it. They can't cure anything. Nothing is curable. That's a problem. And yet here they are saying, do this, do that, give us money to find a cure. Well, they're treating the disease as a crisis, and it can't be cured that way. And we'll tell you in the next segment how to do that with the natural healing paradigm. Now, let me just run over some stats here on you. Now, and these are easy to find. They're on the internet. They're easy to find. The first stat I want to impress on you, and this, ladies and gentlemen, makes me mad every time I talk about it. And I talk about it just about every day. 120,000 people a year die from prescription drugs. 120,000 people a year. Now, to give you some relativity on that, being a Vietnam veteran, Vietnam lasted almost 10 years, 58,000 people died in Vietnam in 10 years. Every year, 120,000 people die from prescription drugs. That's a problem, and that's why we need this paradigm shift in healthcare. We need to stop using crisis therapy in disease processes. Look at, everybody was taught this, well, at least I was. I don't know if they teach it anymore. But remember back when the Portugal and the Spaniards were sailing the high seas and everything, and scurvy came about. But it didn't come about in all the high seas sailing. And it was a big thing, what was killing people. And it's a funny thing, if you look at pictures of scurvy, it's a lot like cancer, which might explain why cancer is getting such good results with vitamin C therapy. But scurvy was caused by not having any fruit in your diet, because the ships that had fruit in their diet, those guys didn't get scurvy. The guys that didn't have any fruit in their diet got scurvy. Now, you can attract the scurvy till the cows come home, you're not going to cure it. You can't. You can't treat it as a crisis. But you can treat the cause of it, a vitamin C deficiency, and scurvy goes right away. That's the problem with the crisis therapy, treating a disease. They declare war on the disease, and it never can be cured. Matter of fact, there are laws, they have created laws that you can't treat a disease and cure it. If you do, if you say you do, you're a charlatan and a huckster, see? And people have gone to jail for that. My life was changed by Dr. Hulda Clark's book, The Cure for All Cancer. Now, her mistake there was saying the word cure, because you can't treat the disease and cure it. Now, if she had titled the book, The Elimination of Two of the Causes of Cancer, it wouldn't have been a problem, see? But diseases are just like the rest of the world. It's a cause and effect universe. Diseases have a cause. Crisis therapy is applicable to an overwhelmed situation. I saw that in Vietnam, and we've all had those situations. We've all needed intervention every now and then, crisis therapy. But it's not applicable to diseases. Diseases have a cause. Now, another stat here, 90,000 people from secondary infections in hospitals. 90,000. Well, between the two of them, you got almost 250,000 people. We're getting up there, okay? That has to change. Crisis therapy applied to diseases has to change. No cures, 120,000 from their main treatment, which is prescription drugs, and plus the hospital admissions where the prescription doesn't kill them, but just the side effects are so bad they have to be admitted to the hospitals, another 300,000 people a year. That's a problem, and that has to change. This paradigm shift in healthcare has to happen. Now, I'm going to throw one more in here. I don't know how many of you are old enough to remember Ralph Nader. I remember him because he took GM on and he got rid of the Corvair, because the Corvair, you crash a Corvair and you're gone, you're toast. And he took them out, and he did a good job of it. But Ralph did some research back in the 90s. He did a 5-year study on hospitals, on death and hospital treatments and what's going on in the hospitals in America. 5-year study. Now, if you know Ralph, he tends to get a little pissed off every now and then, and these are his exact words. 315,000 people, 315,000 people are killed by needless surgery and doctor mistakes in hospitals in this country in 1 year, okay? Crisis therapy is legitimate, but if you apply it to diseases, it doesn't work. Thus the need for a paradigm shift. Okay, now that's part 3, and this is important. Understand this, crisis therapy is valid. It does work. Don't get mad at your medical doctor because he's treating you with crisis therapy. That's the only thing he knows. I know a lot of medical doctors, they're good people. Okay, they've been lied to too. But this is why I'm doing this. We got to get you off of this and onto the natural healing paradigm, which will be part 4, which we'll do next. Thank you for watching. I want you to go to my website. I want you to subscribe to my YouTube channels, and I want you to buy my book. It's Paradigm Shift in Healthcare. Stay tuned for part 4.